So things you will need to set up the transducer is the arterial wave giving set. Usually comes with a few stickers, and you can see the electrical lead in there. 500 mils of normal saline. Tend to use saline rather than Hartmann's. There's been a few cases of kind of potassium misreadings due to Hartmann's, because obviously Hartmann's has a bit of potassium in. So it has to be saline, and a standard pressure bag. That's actually slightly big because it's a litre one. A 500 ml one is ideal. So what I normally do is put the pressure bag up first. You can put the bag in to here ready. Open the transducer pack. That can all be opened like that. So the pieces are the bits, the spike will go into the bag with the roller valve. That will lead down to the transducer, and that bit will be the electrical cable to the machine, and then it will continue down this way to the patient end. So to flush it through, it tends to be easier if you close that valve first. It avoids all air getting in there whilst you're setting up. Spike the bag. And give that a bit of a squeeze, get a bit of water in the chamber. Open that up. Now you'll notice it won't flow immediately because of the transducer part here. This blue bit here you need to pull, and that will actually open the valve here and kind of flush the system. So you can see even without pressure at this point, you can just open that. It will come all the way through, and you can just visually check there's no air bubbles coming through. And you just need to wait for it to come to the patient end. There are a couple of tiny air bubbles there, so what I'll do is just keep flushing it into something just to clear those tiny bubbles out. We shouldn't actually have much of an effect, but might as well, seeing as they were near the end. Fine, so that's done. The next thing is we need to pressurise the system, so close that to the air, and we can pump that up. And essentially we need this into the green zone. So that's where I pressurise. The line is flushed. So that is ready to go to be attached onto the arterial line once it's inserted. We just leave that there. You can actually close that off in the meantime whilst you're waiting, just to make sure it doesn't leak accidentally.